Hello everyone, my name is MCastro. This is my presentation on exacerbation congestive heart failure. Mr. R is a 70-year-old Hispanic male who is currently unemployed and relies on his son and daughter for financial support. Mr. R's spouse passed away a year ago, for which he has not yet recovered mentally. He currently does not have any friends or another family member who can help support him. Mr. R's health care coverage is through Medi-Cal and Medicare. Mr. R was diagnosed with chronic congestive heart failure 3 years ago. He presently taking lisinopril 35 milligrams daily, digoxin 0.0125 milligrams daily, and Lasix 20 milligrams daily. Mr. R is on fluid restriction, measuring less than 2 liters a day, as well as on 2-gram sodium diet, daily morning weight monitoring, restricted activity to reduce cardiac workload, and stress reduction. For this case, the primary diagnosis is decreased cardiac output related to an ineffective ventricular pump. Interventions are as follows. Assess client for understanding and compliance with medical regimen, including medications, activity, and diet. Teach client actions, side effects, and the importance of consistently taking cardiovascular medication. Instruct family and client about the disease process, complications of the disease process, information of medication, need for weight daily, and when it is appropriate to call the doctor. Teach the importance of smoking cessation and avoidance of alcohol intake. Teach stress reduction such as imagery, controlled breathing, and muscle relaxation techniques. Instruct client on the importance of getting pneumonia shot and yearly flu shot as prescribed by a physician. Explain necessary restriction, including consumption of sodium diet, guidelines of fluid intake, and the avoidance of Valsalva maneuver. Teach the importance of pacing activities, work simplification techniques, and the need to rest between activities to prevent becoming overly fatigued. Instruct client and family on the need to wait daily and keep a weight log. Mr. R is experiencing chronic systolic congestive heart failure exacerbation. Therefore, he's exhibiting inability to walk more than 10 steps without becoming agitated and short of breath. Furthermore, Mr. R has evidence of +4 edema and swelling to ankles bilaterally, audible wheezing, difficult with speaking, and takes breaths between sentences. Mr. R needs to follow an elaborate medical regimen, comply with diet restrictions and medication administration. He will need to emerge with a chronic care case manager actively, and most importantly, modify medication and behavior according to obvious symptoms. Furthermore, he will understand the restrictions to emerge out of his exacerbation. For instance, Mr. R is bound to comply with weighting himself daily, keeping a log, and report the results to case manager per treatment plan. Mr. R will require minimum to moderate assistance with bathing, toileting, grooming, ambulation, dressing, climbing stairs, depending on his current symptoms. Mr. R is unable to go shopping for groceries or healthy foods, prepare meals, housekeeping, or managing medications. He will be in need of moderate to maximum assistance with all IADLs. Mr. R discharge planning priorities are as follows. Minimum family support ensures useful and a specific understanding of his complete particular discharge instructions, non-compliant with taking all prescribed medications. Mr. R understands dietary and fluid restrictions. Mr. R will be at a dry weight, maintaining weight, smoking cessation, counseling, initiate and follow up clinic visits scheduled 7 to 10 days out. Patients with acute decompensation should be strictly followed up after hospitalization discharge to minimize rehospitalization. Management of heart failure involves a change in a diet, close monitoring to detect early signs of volume overload, avoidance of any factor that can lead to decompensations and use of medication known to improve survival or symptom. Mr. R discharge planning is essential to prevent a readmissions that can lead to other complications. Proper discharge planning can prevent rehospitalization and assist Mr. R with the overall well-being. Based on his current condition, Mr. R can be discharged using the following clinical judgment. Verbalize the understanding of the disease process, dyspnea relief, O2 stabilized, and breath sounds clear. Recognizing signs and symptoms of exacerbation of congestive heart failure. Verbalize the importance of seeking medical attention when exacerbation symptoms, understanding the importance of fluid restrictions and the 2-gram sodium restriction. Recognizing the importance of medications compliance, home health would also be ordered to ensure a licensed nurse can visit the patient home and assess the safety and organize or set up Mr. R's medication. Furthermore, this nurse may also evaluate the food and nutrition currently at home and provide additional guidance. A nurse case manager's strategy for the patient level is education, in which includes teaching disease, treatment, coaching symptoms, self-management, and coaching caregiving for the family. The system-level strategy of nursing care management that is most significant and beneficial for Mr. R congestive heart failure case is the communication. Communication system-level strategy includes advocacy, team communication, and therapeutic communication. Providing Mr. R with a thorough congestive heart failure teaching plan that focuses on the disease process and treatment will be beneficial in preventing exacerbation. Therefore, it's essential to educate him on signs and symptoms and preventive measures of exacerbation. Coaching him on self-management can improve his well-being and at the same time reduce the cost of care. According to Pender, Murdoch, and Parsons, mentioned in self-management and individual practices in activities to manage illness such as adjusting medications, eating special foods, or taking direct actions such as making a doctor's appointment. Coaching caregiving for a family is another essential part that benefits Mr. R since his only support is his children. His children can assist him with the necessary activities of daily living as well as assume responsibility to implement management strategies. According to the World Health Organization, chronic disease advocacy is essential to correct misunderstandings, build commitment to action, and stop the global epidemic. This strategy is suitable for Mr. R since he's exhibiting exacerbation due to non-compliance with his medication, therefore generating possibility of misunderstanding. Research by the Institute of Healthcare Communication indicates that there are strong positive relationships between a healthcare team member's communication skills and patient's capacity to follow through with medical recommendations, self-management, and chronic medical condition adopt preventive health behavior. Therefore, this research indicates that team communication is an essential strategy to establish the optimal goal for Mr. R. Furthermore, therapeutic communication is a strategy that is the most relevant to Mr. R's case because it generates an effective communication as well as giving him the opportunity to convey any fears and concerns. Communication is a fundamental element to be used by system levels of care in spite of providing high quality care that will lead to a positive outcome in patient satisfaction. Utilization review is the process in which medical review determinations are made based on clinical guidelines and structured process. Modalities establish criteria to evaluate service for necessity level of care for appropriateness, quality, and the timeliness of discharge. Mr. R will follow up every 3 months with primary care physician or PCP, in which all activities are designed to maximize prognosis. For ongoing monitoring of Mr. R's heart condition, he will require to follow 3 months with a cardiologist. The cardiologist will be responsible for providing diagnosis, treatment, and care accordingly. Moreover, the cardiologist has the final responsibility for medical management, completeness of an investigation, and planning initiation of the therapeutic strategy. Mr. R will need to follow his symptoms via chronic care management at home. Supportive care for Mr. R consists of dietitian, physical therapist, pharmacist, home health, and psychologist. Each role plays an essential role towards managing Mr. R's condition. For instance, a dietitian can help evaluate dietary intake, formulate, tailoring, and advise diet, and help patient to improve compliance with prescribed nutrition recommendation. Physical therapy can advise the patient with heart failure and recondition a training and give particular advice on energy conservation. Pharmacists can include providing information to physicians in choosing the appropriate drug regimen and dosages, and improve compliance and the patient knowledge of heart failure. Psychologist will guide him to overcome his depression. Quality and safety is as follows. Medication were given in a timely manner. Fall risk assessment and interventions was instituted. Communication among healthcare team and safety risks at home. Mr. R was able to verbalize understanding toward his disease process as well as recognizing signs and symptoms of exacerbation. Moreover, Mr. R struggled to understand the preventive measures, including managing activities of self-management. However, it was a success in teaching family of the importance of preventing measures. Furthermore, family verbalized understanding of assisting Mr. R with necessary activities of daily living, as well as accepting the responsibility of managing his activities. The system strategy of communication was a very useful since this strategy was able to correct Mr. R's misunderstanding and understand the importance of establishing the optimal goal. Moreover, accept to comply with the plan of care, this strategy established effective communication in which it provides Mr. R with the opportunity to convey his fears and concerns.